So you're signed up for Medicare A and B. Now what? What are your options? What are you looking at as far as the full Medicare landscape that's in front of you? Let's dive right into it and kind of cover the three options here that you'd be faced with. Option one is original Medicare A and B, along with a Part D drug plan. We also call these PDPs or prescription drug plans. What does original Medicare actually cover? What does Part A cover? A, if you'll notice on your card, it'll say hospital on it. Hospital coverage will cover inpatient hospital stays, skilled nursing, and also hospice care. Now, something to keep in mind, deductible for Part A is $1,736 for each coverage period. So there is a possibility, that's not for the year, there is a possibility that you could pay that more than once in a given 12 months if your health was bad enough. So that's something to keep in mind. What does Part B cover? Part B covers doctor care, preventive care, outpatient care, labs, imaging, durable medical equipment, things of that nature. So it also has a deductible of $283 for the year for this year for 2026. And then we've got Part D. D, I kind of keep it simple for me. D for drugs, prescription coverage. And then Part D plans, no matter the insurance carrier, have a $2,100 maximum out of pocket for the year. As long as the drugs that you or the prescriptions that you're taking are on the drug formulary or drug list on the plan that you have, then that would be the most that you would pay in the 12 months here for 2026. Now this number can change from year to year. We'll see what next year brings. Last year it was $2,000. This year it's $2,100. So that's option one. Option two would be to have original Medicare A and B along with a Medigap plan and a drug plan. We know what A and B covers now. What does a Medigap plan do for us? So Medigap plan, also known as a Medicare supplement plan, is a plan that's provided by private insurance companies. They're designed to sort of fill the gaps, that's sort of where the name comes from, for original A and B. Now, some people realize this, some people don't, but Part B of original Medicare will only cover 80%. So if you think about doctor's visits or labs or CT scans or that outpatient surgery maybe you've been putting off, whatever it is, things like that, then you would be subject to 20% of that cost if you have original A and B. Normally, I don't recommend anybody in this option one. Normally, I'm going to recommend either option two or three just for the financial impact or the coverage there to protect you financially from some sort of huge bill down the line that maybe we weren't prepared for, because there's no cap on this 20%. That actually goes to infinity. So a Medigap plan is designed to help fill that gap for you. Now there's multiple Medigap plans in your Medicare and You book. I believe it's on page 78 this year. Gives you a chart of all the different plans, what they cover and what they don't. And then again, we know about Part D where we covered that. Same situation here where you've got that max amount of pocket cap. Option three is actually what we call Part C, or also known as a Medicare Advantage plan. This is also provided by private insurance companies, and it combines A and B and C and a lot of times D all into one plan. These plans we see pretty heavily advertised in the fall of the year during annual enrollment. These plans work with networks. They have their HMOs and PPOs. They do require prior authorization for a lot of services, so that's something to keep in mind. But they also include a maximum out-of-pocket limit, so a financial cap or a stopgap to protect you. They also include a lot of extra benefits like dental and vision, maybe some money towards hearing aids, things like that. So that's what works here with the Medicare Advantage plans. And I've also listed down here an optional HIP plan. Stands for Hospital Indemnity Plan. And that's something strictly optional. Every situation is different, but these plans offer some additional coverage towards things like inpatient hospital stays, ambulance rides, possible surgeries, or even things like CT scans or PET scans MRIs, things of that nature, where they can have a fairly high copay. And a plan like that can kind of help cover some of those items as well. So these are the three options that you would be faced with once you sign up for A and B. Everybody's situation is different. It's good to know and understand the full landscape that's out here in front of you. More questions will be answered. Follow along for more.